I was diagnosed with prostate cancer at age 58 based on a rising PSA. This was discovered because I was seeing a urologist for kidney stones, and they did a PSA as part of their workup and that sort of thing. It was mostly low-grade disease and a very small amount. And when I initially got the news, I said, well, that's nice. I'll see you in 6 months or a year. And they said, not so fast. And they argued that because of my relatively young age and life expectancy at that point, and because of the fact that even though it was low volume, there was some evidence of intermediate risk disease, that the only alternatives really for me were surgery or radiation. I asked a lot of questions of my urologist and ultimately my surgeon about the side effects and consequences of surgery and treatment. I don't feel in some instances that I got accurate information from them. And I went ahead and had the surgery when I was 58. And I found that the consequences, particularly the sexual consequences, were much worse than I had been led to expect. And this made me very angry. And I actually fell into a clinical depression that I didn't realize what was going on because they don't typically warn you about the possibility of depression and some of the other things as a possible outcome of treatment. And I didn't realize what was going on until I became suicidal. And at that point, I went back to my surgeon and we arranged for a mental health referral. And I got some medication and I got some therapy, and that helped me a great deal.